Hello and welcome to the first episode of the Maternity Show on ARTV. What better day can we premiere this show than on the 8th of March, where we celebrate women and all the activities that they do for the development of different countries. Of course, today this episode is going to focus on what maternity is all about and what services are there for women as far as maternity is concerned in the Gambia. We are here at the Ministry of Health Complex in Banjul, the Gambia. Follow me as I get you through what services are provided for women in our health facilities. My guest today is the Director of Health Services. Let's find out. All right, we are here with Dr. Bite. Of course, Dr. Bite is everybody's Dr. Bite, the Director General of Health Services in the Gambia. Dr. Bite, you're welcome to the Maternity Show. In fact, this is the first episode of this show, and we are so lucky to have you premiere this show. But who better than you to premiere this, because you are going to tell us about health service delivery in the Gambia as far as the maternal health is concerned. So Dr. Bite, kindly describe to us how you feel about the services that are rendered to women in the Gambia.
Wow, thank you very much, and I'm very honored to be part of this show, let alone being the first one. So it's a big privilege that we have, and we appreciate it. And we pray that this show becomes a blessing for the whole country and benefit women in this country and everywhere. So we are really honored, and we wish you well.
Thank you.
And really for us, it's in many ways, because now I serve as Director of Health Services, but also I'm an obstetrician and gynecologist. So we really support this show because it will encourage people to know about women's health in general, and especially to help us reduce our number one headache in the health sector, which is to reduce maternal and child mobility and mortality. So for the services generally, I think that the truth is that it's improving. It's not where we want it to be. Yeah, there is a lot of room for improvement, but we are happy that we are on the right direction. And if you look at the trends, most of our indicators are improving. And that is what is very important. Now, what we need to work on is to improve on the speed at which we are, improving, regarding the decrease in the maternal mortality and morbidity, and the child mortality and morbidity.
Yeah, right. So we know that change is gradual. It takes different players to come, and then we get there. So probably we can discuss on how a woman's maternal health can really be improved. Okay, let's talk about what role can they play, because we know that the health facilities, the hospitals and the like are really doing their quota. So how do we women come in to support you in the work that you do?
No, I think one thing is like what you are doing and what every woman can do, that is to advocate. That is to help one in ensuring that, when we are selecting, when we are advocating, we advocate for women's health. Like if we go to our National Assembly members, we tell them that let them put that as a priority.
Sure.
So when they are doing the budgeting and all, then they will consider health. The other thing is that we have to ensure that all women are educated and they stay in school. So it's very important that women stay in school till they reach high school, because in that process they will be aware, and then they will know the risk, and then they also stay in school so that they don't start this reproductive life early. Because if you are educated, the tendency for you to start this is minimal. Then the other thing is also women need to be empowered.
Yeah, right.
So you hardly see, very, very educated women dying in labor.
Yeah.
Because they don't wait for anyone to give them care. They don't wait for anyone to give them. So once they are sick, they quickly go to the hospital. And when you go to the hospital on time, it's usually, the outcome is usually good.
Yeah.
So that's why women should be empowered. They should, be educated. They should have resources and all that. That will really help. The other thing is that we want the women in their homes, to help have a mechanism of helping the women who are pregnant so that they register early and go to the hospitals early, and they support them in such a way that once they need service, the community can ensure that there's no delay.
Yeah. So talking about services, this brings us down to knowing or to letting our women out there understand what services there are for them at healthcare facilities when it comes to pregnancy, childbirth, and all that.
So in the Gambia, really, we are lucky, especially for the, you are a public health expert, so you know about the vaccination.
Yeah.
So Gambia, we are among this top in the sub-region for the vaccinations and the child immunization and all that. So we are doing very well. So the other thing is also for antenatal services.
Yeah.
That is, women who are pregnant, for them to register for what we call nurse, antenatal care. So that one too, we are doing very well. But where we are not doing very well is the early registration. Most women, they don't want to show their pregnancy early.
They have lots of issues that they complain. Gene issue, cultural issues.
Yeah.
And I think they also hide the fact that if you're pregnant early, people will talk about you being pregnant. These are notions that women really carry, and it's not helping them as far as their pregnancy is concerned. So knowing the services that are provided for them, I think it's also important that nurses in our community, because I think we have different levels of these nurses that we have. We have community health nurses. This could be people that can really help women in their various communities to come out when they are pregnant, because this would further help them to reduce complications during delivery and all that.
Exactly.
All right, so this will now take us down to understand how accessible some of these services are. Because let's look at the scenario. A woman that is from Bohum Kunda. Bohum Kunda is a community that is almost in Senegal, very far. And the last time I visited, their health post has issues and all that, so barely you would get to see an RCH team coming there because of the transportation issues. So how would that woman or a woman from that community access health services?
So it's a good point. We are in a process. In the Gambia, there's about 1,889 villages. So we need to have almost a health post in every 7 village. And then each of those villages need to have maybe community health worker, or so that they can help them to, but we've not reached that level yet. So still, we have the health facilities, distributed in a way that almost every 5 to 10 kilometers you will have an opportunity. But like you said, it's not that in every community we have one yet. Yeah. So, but we are working towards making sure that we take the services very close to the people. For example, in North Bank alone, we are building, for example, one new BMOC facility at Chisemajau. So there is already one at Kuntawur. There is one at Kuntaya. Yeah. So we have already Kir Ardo, all those areas. Yeah. So we are trying to improve this access so that quality service. If you go to Salikanya, we are building a new one. Tumana, we are building a new one. So this is all to just help Njao, Kawur. So we are in the Gambia. What we've gotten in BMOC, if you go to other countries, WHO recommendation, if you go by WHO recommendation, we just needed maybe 7. Okay. But now we have far more than that. But we don't think that that's enough. We still want to make sure that we have these facilities very close to the people as much as possible. But where we don't have the facilities, what we do is we have trekking stations. Yes. So, like for example, around Bohum, Kunda, most likely a facility will be trekking there regularly, maybe every month. It will not be every week, unfortunately. It's on monthly basis. Yes, based on the catchment area they belong to. Yeah. So it will be every month, although that we need to improve on that. That's not the best of services. We need to have them to have the opportunity to go there every day when they need it. But because of the constraints we have and the limitations, for the time being, what we are providing is monthly visits.
Yeah. So I think that really helps with the check-in side thing, because with the tracking side, they're given the opportunity to have access to basic primary healthcare services and all that. And also in every community, I realize there is a village health worker that works with the community health nurse. So this is also maybe a step in the right direction that will really help our women go through the best services that they can have. So I think most of the complaints are around, okay, there is this particular person available, and let's talk about how available they are. He's there, but the materials he should be using are not available for him. So how do you expect
So
him
that
to
one
do?
we are really sorting it out, because if you realize what happened is that we have this RBF.
Yes.
So what we are now doing is not everything now you have to go to the central level. We put resources on with you based on the amount of good services you do. So that's what we are doing. We need to expand it. But now if you go to all of our facilities now,
They are doing well.
They are doing well. You see some of the facilities, they manage it so well that they could even construct. They could even construct staff rooms and all that for them. So because 40% of it you need to utilize it amongst the staff, but 60% you need to
Goes
take
to
it
the
back.
welfare of the facility.
Again and all that. So you can use that to buy drugs. That's why they have drugs and all that. And it's linked to quality. If we come and assess and your quality is down, then we don't give you that resource. So everybody is improving on their quality, and that means a better service for the people.
So that reminds me of this particular scenario. There is this particular health facility. I wouldn't want to mention names, but they are really doing very well in terms of A&T, because I think for every pregnancy you record, also, or for every delivery you do, you're being paid, and your hospital receives lots of money. So they're trying to encourage people from the community to come to the health facility, and then they can receive most of the services that they're providing for them. So I think that is also a very good thing, and we are not forgetting that we are talking about women on a very special day for them, which is on the 8th of March, celebrating all their efforts in their different diversities. So Dr. Bide,
so happy Women's Day to everyone.
All right, thank you. So that will now bring us to understand really when it comes to pregnancy in general. I know pregnancy, it's really something that I wouldn't want to say much about because I've never been pregnant, but I know it's something that is really worrying for most of the people in the Gambia, because you have very young people that go through pregnancy, and at the end of the day, it's either their babies will die or they themselves. So I think that is something that is really alarming. What are we doing as a government about that?
No, I think the way you said it may not depict what is happening, but I think with the social media, with all these things are now, with the democracy, things are now being expanded more, and people is become more visible, which we really like, because it raises alarm. It makes sure that people are not happy and they show it, and then it put pressure on everyone, because we have to maintain that pressure until no woman dies again. No one woman dies. But if you look at the data, it's not showing that. Like in 2013, what we were seeing was 433 deaths per 100,000 life birth, 433. But now in 2019, we're having 289. And recently our service data is showing less than 220 or 189, something like that. So there's a trend that it's decreasing.
It's decreasing.
And it's not, we are hoping that by 2030, realistically, we will have 70. But it doesn't mean that 70 per 100,000. So that's our aim, and inshallah, to try to reduce the maternal mortality
to an acceptable level. But something makes me wonder, big form of confusion. Are we really reporting the actual deaths that are happening? And also, are we talking about the deaths that will happen at home and they are not recorded? So where do we capture those ones in?
Very good point. So the way maternal mortality reviews are done is not even our data. So this is independent body, GBOS, using different methods, statistical methods, to go and assess the maternal mortality. So our service data is different. And by the way, our service data is very improved because of the RBF. So now, if your data is incomplete, you don't get money. So they are actually now making sure that all their data is correct. So you understand what I'm saying? Now our data, you can say it's perfect. Because if you miss out, you lose a lot of resources. So this is what RBF does. It brings quality. Now, before, the teaching hospital, you don't get the data as you want it. But now, they are the ones calling. to make sure that their
this
data is
done.
fine, everything, and
I
also
think that's a really good
the data
thing.
we have is really good now. But what I'm talking about is like using the sisterhood method,
Yeah.
using other methods. So this is an independent body with the partners, UNFPA, GBOS, and others, doing the assessment and saying that, oh, now it has reduced. So that's different from just our service data telling us that this is what we have.
Yeah. All right. So I think since it's on the improved side, we pray that it's improved and improved and improved until we get to the 70 that you are talking about. So quickly, let's just discuss about pregnancy, Dr. Bite. I know this is going to be on a separate show, but I want to use your experience as one of the best gynecologists we could come across in the Gambia, of course. So tell us how women go through pregnancy, and what do you think is really affecting some people when they go through pregnancy?
No, I know that pregnancy, like you said, you've never been, I've never been as well, but we've worked closely with them for many years. And I think it's a very difficult period for the woman. And it comes with a lot of expectations and a lot of triumphs, mixed feelings, and all. Because remember that we are in a society, although it's changing, where once you are married, within the first 2 years, people are expecting a lot.
To have a baby, and if you don't, they start questioning you, and then what happened to you?
And it puts a lot of pressure on the couple, like both the husband and the wife. So, and once they found out that they're pregnant, it's a very joyous moment. But then pregnancy itself is inherently associated with a lot of other issues. Like normally you are expected to have vomiting. You have some feel very funny feelings, you have pains, and all these things. You have dyspepsia, like when you eat, it doesn't feel good, or you feel like vomiting, and all. So and sometimes because of the drugs you have constipation. So you have to accept certain things that normally you wouldn't have accepted.
Yeah. So it goes with the psyche at some point.
Yeah. So you need to be prepared for that. You are happy already, but then you have these small ailments that you have to deal with.
Yeah.
And then your expectations are there. You want to really have a baby boy or baby girl, or and then you are also worried about what you are having, how the baby is going to come out and all that. So because of that, we have this positive experience, antenatal care, that maybe Dr. Marian and others can give you more update, because we want to have women to have a positive experience throughout their pregnancy. We want to be there, cheerful, help them to have quality antenatal care, do scans for them, tell them what is happening, and all that. So we want to make it as bearable for them as possible, because it's a very
maybe this will change
tortuous
my
journey.
mind at some point, because I was really afraid of pregnancy and all that. So talking about let's say some of the things that they go through, I know most women would also have issues at home, especially let's say intimate partner violence. So are there things that the healthcare providers do to help these women that go through such issues at home?
For now, in the Gambia, we are lucky. We have, WHO says that if you don't have a system of taking care of those with these issues, sometimes screening in pregnancy doesn't make sense. But for us, we are lucky in the country because we have network against gender-based violence. We have institutions
that are helping
take. So what we advise is that during the antenatal, you try to screen it, try to see people who are going through these things, and if you pick it up early, you can refer them for further care. Some women are really going through a lot, especially during the COVID, when you are at home, no resources and all. But it's something that if we pick, we have institutions that can help them. We even have one-stop centers in many of our facilities where they can take care of this easily. And many of them are actually gynecologists, so they can actually pick.
Nice, because I think it's really important. Gambians are fond of not talking about their issues because they feel that if they do, they're trying to expose their marital issues. And I think it's important to discuss some of these issues because it's going to help the woman mentally to go through pregnancy safely. So,
but the good thing is that they can discuss it with their carer. So that's like in a very safe zone where you are with your doctor, a nurse. So there you can expound everything and tell them all the issues you have. Then they can see how to support from there.
Right. So talking about a carer, I know there are lots of people that are going to watch us that are preparing to get pregnant and all that. What do you want to tell them?
So pregnancy needs to be prepared for. It's not like it should not be accidental. Although in Gambia most of the time it's accidental.
Yeah.
So usually, like you should before you get pregnant, it's good to visit your carer, your doctor or whoever, and then most of the time they need to make sure that you are in an optimum state. You know, if you have any sicknesses, they need to make sure they are handled and taken care of. For example, if you have any illness like diabetes, hypertension, so it is controlled before you enter the pregnancy. And sometimes they can give you some prophylactic drugs so that they replenish your stores and all that before you enter the pregnancy. So it's a good habit before you get pregnant. If you have any infections, they could treat them first before you.
I think that's important.
Yeah, so that's something that we don't do in Gambia, but it's important that people take care. And when you get pregnant, once you miss your period, you know, it's good to register and go, because it's important they do that initial scanning.
Yeah. So gradually, we are talking about maternity and maternal care.
Yes.
So that will now bring us to, let's say, now that you've prepared for pregnancy, and then pregnancy is here now, how do you even know that you're pregnant?
Yeah, so that's important. You need to go see a doctor. Once you miss your period, sometimes you start feeling like vomiting and all that. You should see the doctor. Then they do a scan. When they do a scan, they want to know whether the pregnancy, how old it is. It will be pregnant. Sometimes when you use just the last menstrual period, you may miss it.
Yeah.
You know, some people don't remember very well. But if you do an early scan, it can help you with the date. Tell you exactly how old is the pregnancy. Then we can use that to monitor the pregnancy throughout.
I mean, it's also improving because we now have apps that can track your menstrual cycle for you. So they could tell you when next is your cycle, when last was your cycle. Probably they can help you detect.
That will help. But the problem with that is sometimes, you know, some people may have they may be pregnant, but they may have a slight bleeding, what we call implantation bleeding or whatever. It will be around the time you are expecting your menses.
Oh.
So you will think that is menses.
Okay.
So, but if you do a scan, it will tell us, no, actually, you may think that your pregnancy is just 6 weeks. But when we do a scan, it can tell us, oh, this pregnancy may be 12 weeks.
Okay, so this is also confusing.
That helps.
Because I've also come across a woman who has believed that she's pregnant. She has shown all signs of pregnancy, you know, and all of a sudden when she got to the hospital, there was no period coming for her anyway. When she got to the hospital after 3 months and she scanned, but there was no baby found. So that also had to go through her psychologically, and she was not talking to anybody, you know, and all that. So I don't know if these are issues that are really happening to most women, or it's as a result of she got pregnant and it happened to be a miscarriage, I don't know, or there was no pregnancy at all.
Yeah, there could be a lot of reasons for that. There are a lot of reasons why women will not see their menses. There are a lot. So sometimes, you know, just your fat level, if it is very low, it can be, some women are very strenuous exercise and all that. So, and sometimes the reasons why you don't have can be from, you know, what we call the hypothalamic pituitary axis, can be from the ovaries, maybe because the ovaries are not functioning, or can be from the uterus, or even, so there are a lot of reasons why somebody may not see their menses. So that's why just not seeing your menses is not enough.
Okay.
So sometimes not seeing your menses does not mean you are pregnant. Sometimes some people just the stress. If they have too much stress,
that
that alone
can
cause them to have not see their menses anymore. We call it amenorrhea.
Okay. So stages. We are now from that part that is telling us how you can realize that you're pregnant. Okay, let's say you've gone to the facility now and you're told that you're pregnant. What is next for you as a woman?
Yeah, so after that, so they will do some tests for you and all, and they will give you appointment. You have to be religiously following those dates. So because if they tell you come these dates, you have to come those, because each of those days there are things that they do. Okay. And you'll have the opportunity to check your BP, to do some scanning and all that, and the weighing. So those are all important.
And that falls under the antenatal
service. So anytime they see something abnormal, then they can take a course of action. But you need to be regularly going as they've scheduled, so that you don't, they ensure that everything is going on well, like the level, the way the baby is growing. They want to know, because there's an expected growth, so they'll check all that. And if it deviates from the normal, then they can take a course of action.
All right, so I'll just remind our viewers that we are still trying to describe maternity and the care that they should receive. So once that is done, and let's say it's now time for delivery, what happens at this stage? We're looking at the labor ward. I mean, they do a lot of work, the screamings that they would hear all the time. So I know there's a lot of things that they do. We will talk about that when we get to their side. But briefly, on the stages, now that you've gone through your antenatal care services and it's time for delivery, what happens?
Yeah, so the antenatal is important that they know that there could be a lot of things that can go wrong. Some women can fit. So some women can fit before, and that's dangerous. We call it eclampsia.
Okay, yeah.
So that one is picked early if they are checking your BP every time. So some women, if you think that the BP they are checking is not important, it's very important.
Yeah.
Because when we pick it early, you will never have eclampsia, inshallah, because we can prevent it. But if you are not going for your visits, you can be having high BP, you will not know. By the time you know your eyes are blurry, your head is ringing, and that's late, right? You have eclampsia.
I think I've seen something like that at one community in URR. This lady was walking dead. That's how the doctor described her to us, because her BP was so high. I can't remember the exact number, but immediately we checked because we had an activity. We named it as the hypertension and pregnancy. So we went with few nurses from Yorubawal, and they were trying to check the BPs of the pregnant women in that community. So when they got to her, they tried to check, and immediately she was rushed to the hospital. So the doctor was like, "This lady was walking dead." I'm like, "What is that?" She's like, the blood pressure was so high that if at any chance she happened to fall also, she might die at that point. So I think
it
it's
happens
really
a lot. Many people, they will not know that their BP is going up, and they stay at home. So it's good to go for testing, because when the BP is going up, you don't realize most of the time.
Yeah.
You only realize when it's late most of the time. You start having symptoms, headache, blurry vision, and if nothing is done, you can have a stroke, or you can have eclampsia or something.
All right. So now that the delivery is done, women might think that is the end of their going to the hospital, not knowing there are other important things that they should do until when the baby gets to 5 years. So how do we call it? I think it's a postnatal service.
Yeah.
So tell us about the postnatal services.
So so after the delivery usually you can have it natural, or you may have cesarean section. And after that, you need to make sure that you visit at least twice the hospital. They keep you there most of the time 24 hours. But sometimes where the beds are difficult and all, they may release you between 6 to 12 hours or so, making sure that you are fine. But our policy states that you have to stay most of the time for 24 hours to be checked and make sure before you release. After that, within 10 days, then you need to come back so that they check. Some women, in the yoka, you have episiotomy. They need to check whether it's healing very well or not. They need to know how you are breastfeeding, if there's any problems. And, generally how you are doing. Is the blood coming? Is it normal? You have an infection? If they detect anything, then they will help you. So and that period also, they talk about family planning in case you need family planning.
So those are all services that they offer. So while you were talking about coming back within the first 10 days or so, especially for those that have gone through cesarean section. So I think it's also important that if you talk to the women that have gone through that, you can also talk to their husband or their care givers. Because it happened to a lady, I think along the line she got infected where she was caught also, and she was returned to the hospital. She spent another couple of weeks. At the end of the day, she had to go through another surgery upon the first surgery she had. And that was so painful for her. I think it was as a result of infections that went wrong. Somehow they were trying to clean the wound, but not doing it the right way, using any type of rag. So maybe we could just shed light on that to help women really understand how to take care of themselves once they go through cesarean sections.
So when they go through cesarean section, those ones, they don't follow the routine, like coming 2 days. So the doctors will tell them, sometimes they keep them 3 days to 5 days after the CS, depending on the method of CS they use. And then, they ask you how to clean it. They will teach you, before you leave, how to wash your hands and take a cotton, use spirit to clean and all. So most of the time, they may put sutures that you don't have to remove. Or if you remove them, you will just they cut the tip and then pull it out, maybe around the 5th or 7th day. So if there's then they ask you not to do strenuous exercise, not to do a lot of things and all. But sometimes if the wound is infected, they need to give it time to make sure that they address it until it's all clean. And if it is clean, there's what we call secondary suturing. They may have to come back and just suture that again properly, because so that it doesn't gape like that.
It sounds so emotional.
That's what happens sometimes when somebody has infection. They'll be cleaning it every day until all the dead tissues are removed. If all the dead tissues are removed, sometimes there's need to close it again so that there's no gap and the scar is not big. So that's what we call maybe secondary suturing.
Wow. Women really do go through a lot. I mean, so once you've delivered and you have your baby safe, sound, the next part is the postnatal, which is done, and then that also includes the immunization schedules
for the children.
Yes. So we will have that discussion, because it's important that mothers out there understand it's not just about getting pregnant, it's not just about delivering, it's also about how you take care of that child that you've brought out to the world. So I think it's important. At our session with the immunization team, they will tell us how this is done and what vaccines they introduce to these children at birth until when they get to 5 years. So before we allow you go, Dr. Bite, we know in every institution there of course are challenges, and then that would not exempt your institution. Tell us what challenges you face and how can these things be improved together. There are separate units we have in Ministry of Health, of course. We have separate directories as well, and each of you is trying to do something to make sure our health system is improved in the Gambia. But we still have challenges. Can you tell us what these things are and how we can improve on them?
Yeah, but as a third world country, we have so many challenges.
Yeah, I know.
So one, for example, is the human resources. So we need community health nurses, for example, in every village. We need access to facilities almost at the doorstep of everyone.
Yeah.
We need, so that means we need more health facilities in all these places. So if you come to, for example, the nursing cadre, we don't have the number of nurses to patient ratio.
Yeah.
There's a lot to be done there. Luckily, now, for example, we have increased the intake for CHN and SCN.
SCN,
Yeah, but if you look at the university also, doctors, we are training them here at the undergraduate level. But for specialty training, we are not doing here. Since Gambia started in 1965 till now, we just started training Gambians in our own country for specialization.
Wow.
So what that means is that you will not have enough doctors who are specialized in obstetrics.
And they are all hell-bent on staying in urban Gambia. I don't know. But what will happen to rural Gambian people? I mean, doctors that are specialized on a specific thing. Most of them would prefer to stay at the urban Gambia than going to rural Gambia.
No, we have to. That has to change, because, the Gambians are everywhere. So right now, if you see, like in Soma, we've started operating there. We've started operating in SL.
Wow.
People are operated in SL. That was not happening before.
No.
We are operating in Farafenye. We are operating in Basse. We are operating in Bansan.
Yeah.
So we're hoping that very soon we start in Kuntaur and then gradually. Before Basse, they have to come to Bansan.
Bansan, yeah.
But now Basse, they are
that
operating.
takes lots of time and challenging traffic.
So gradually we'll go up to Koina, go Kuntaur, we'll go up to all places. So, but now we are training specialists in Gambia. Before, you have to depend on Cubans for that, or you have to depend on people coming from outside, and that's expensive.
Yeah.
One thing that's going to help us with that is the National Health Insurance.
Yeah.
So National Health Insurance is coming to ensure that they procure those services. So hospitals will have the resources all the time to buy their drugs and all that. The RBF is helping us with that. It is making sure that all these facilities are having now drugs, or things to use. They don't have to wait for central level to bring. What we bring, if it is finished, you have some money to buy bridging until our supplies come.
And this is covered in the national budget?
Yes. Luckily, the Ministry of Finance is very supportive with the RBF. They are providing funds for that. And we hope that they will also provide funds for the National Health Insurance soon.
So would it mean like one of the challenges we could also highlight would be on the side of budgeting?
Yes, because the national cake, is limited, and you need to do health, you need to do agriculture, you need to do gender, education. So that's the issue. So we all have to look at where you have maximum impact. Then maybe they fund that. But the National Health Insurance (RBF) is really, you know, what money that well
But I
spent.
think other development partners are really trying, the likes of UNICEF,
World
WHO,
Bank.
World Bank,
World
yeah.
Bank. Especially World Bank has been very supportive. Like all these programs I'm talking about, they are the ones helping to fund. Now there's a lot of trust to the ministry. The World Bank now works through the ministry, and then they're convinced that our systems are very, you know, corruption proof or something like that. So they're funding a lot of resources now into the health sector.
Right. So I think one of the challenges we might have.
But UNICEF, UNFPA, they're all helping,
they're all
and
helping a lot.
WHO, and all of the
They've
other
been doing a
partners.
lot with Ministry of Health, and I think that's really helping us improve our health system better. So in most facilities, we realize that most of the patient records are taken through paper and pen. How do we have any plans in trying to move from paper and pen to technology at least? Maybe this will help us keep records better.
Yeah, we are working on that. Already got a firm working on the logistics one, electronic logistic medical information system, or the human resources one also electronic. We already got a firm. That one we advertised 2 times. Then the second time we got, and then the NHIS also we got a firm. So we are already working on all these so that very soon we'll have an electronic system which is going to help track all the patients you are seeing, making sure their labs, everything. You get all the information so that you can make real-time decisions based on information.
This helps you also procure the materials you might need, and avoid duplication.
And patients can also have it probably in their phones, their records.
Like an app sort of. Yeah, that would be helpful. I think that is beautiful. So we are wrapping up, Dr. Biti. It was really nice having you on this show to talk to us about some of the services that we have as far as maternal care is concerned. But before we let you go, probably you can share with our viewers your final words.
No, thank you very much, and we appreciate the gesture. And we hope that we wish you well, and we encourage all women who are pregnant to register early for antenatal care. Is very important. Thank you.
Thank you very much. And viewers, that ends our today's episode. All right, viewers, that marks the end of our first episode where we highlighted key services the Ministry of Health is giving for maternal health care services in the Gambia. I was your host, Sona Davo, on the Maternity Show on ARTV. Until we come your way again, bye from me.